You've seen the results: Ozempic face and Ozempic butt and even Ozempic feet. But how do these supposedly miraculous weight loss drugs even work? And can they do things like change your personality or help you with your alcohol addiction? You've asked for this, so here are the important facts on the GLP-1 agonist from a drug scientist perspective. So the first thing you need to know is that our idea of hunger is way more complex than you think it is. Now, the problem is that we eat for a lot of reasons other than we're just hungry. So think about it for a second. What are some other reasons that you have eaten? You might be bored. You might be sad. It might just be in front of you and look really good. You could be guilted into a second helping of something. All of those are reasons that we eat that are outside of just being hungry. And then hunger itself has so many different aspects to it. So, for example, we have chemical signals that say, hey, the last meal you ate was relatively large. You don't need to eat again. We have specific chemicals that tell us about the last time we ate, so timing versus portion size. We have chemicals that are specifically linked to our long-term fat reserves. And this is why it's so hard to gain weight and to lose weight. So GLP-1 agonists like Wegovy and Ozempic work on one aspect of this. So GLP is basically released in response to food. So after you eat something, it's released to say like, okay, you are good, you don't feel hungry anymore. And it slows down stomach emptying, which makes you feel full longer. And so these drugs are basically increasing that signal saying, yeah, you don't need to eat right now. Now, most of these drugs were originally approved to help with type 2 diabetes, but then we discovered that they also really help with weight loss. But the problem is that sometimes people who need them for things like diabetes are not able to access them because people are trying to use them for things like weight loss. And since they're relatively new, they're extremely expensive right now, but that has not stopped the popularity. And again, it's because they really actually do work. So people lost on an average of 10 pounds when they were on things like Ozempic or Wegovy. And weirdly, these drugs seem to work better for weight loss for people without diabetes, specifically for younger women without diabetes. The most common side effect is like basically GI upset. Like you are messing with your hunger system. So it kind of makes sense that you're going to feel nausea or that you're going to want to vomit. These drugs are also linked to things like malnutrition as well as loss of muscle mass, which kind of makes sense because if people are losing weight, then probably some of it is going to be from their muscle mass. And we see that on average is about 10 to 25%. Now, this is true of people who are not doing any sort of like fitness regimen at the same time. So if they're exercising while taking these drugs, that can reduce some of the muscle mass loss. And it can also help with one of the main problems that exists. And this is not necessarily a problem with the drug itself, but a problem of how people take this. So with things like GLP-1 agonists, basically you lose weight while you're on the drug. So it reduces your hunger while you're taking that substance. The problem is that once you stop, your hunger is no longer reduced. So a lot of people gain that weight back as soon as they quit using the drug. So if you're using this with something like strength training, you might not lose as much muscle mass and it might help you keep the weight off. But in general, people kind of seem to bounce back to their original weight, or at least start to gain a lot again. So one of the problems is this is an expensive drug that you'll probably just have to take for a long period of time. Otherwise, it's going to kind of go back to the way it used to be. They also say that the effects typically kind of plateau at 1 year. So you might be losing weight for like the first 8 months, 9 months, 10 months, and as soon as you reach a year, you stop losing weight. Now, there are also worries about kind of other side effects of the drug. So one of the top ones is depression. There were originally some links that suggested that people who take GLP-1 agonists might be more likely to show depressive symptoms, but most of the recent evidence suggests that that's probably not that big of a risk. There's a lot of anecdotes about people having things like cognitive issues, people having memory impairments, people having personality changes because of the fact that they're taking GLP-1 agonists. So anecdotally, I was working with someone who started taking a high dose of this, and they ended up having a lot of memory problems that actually kind of affected their job. So they would forget decisions that they had made. They would kind of forget what they were doing. They actually couldn't even recognize people as well. People who start taking these just do not feel hungry, and so they kind of have to force themselves to eat, which in some cases leads to disordered eating. And this is one of those things that doctors try to track really well to make sure that it does not happen. Is it doing things like changing people's personality? I mean, probably not. As of right now, we don't have good evidence. We have like one case report that says that and a rat study, and that's pretty much it. So maybe not personality changes, but definitely physical changes. So this is why we have this idea of Ozempic face and Ozempic butt. It is not necessarily that the drug is causing that. The drug is causing rapid weight loss, and rapid weight loss causes that. So that kind of like gaunt look that you see, as well as kind of like the saggy skin in various places, that is just the result of losing weight at a very fast rate, one that your body is not necessarily used to. So Ozempic is working for weight loss, but is it working for all of these other things that we're testing it for too? So people have tested it for things like Alzheimer's and Parkinson's and depression, as well as things like drug addiction. And what we see is that for things like Parkinson's and depression, it doesn't actually seem to work that well. That's kind of similar with Alzheimer's. It might work as a preventative, but it's not actually helping with the plaques and tangles in the brain of somebody who already has Alzheimer's. But drug addiction, now drug abuse has some kind of promising results to it. So there are clinical trials running for a variety of different substances. Seems like it could maybe work for things like alcohol and nicotine. Now, how? We're not entirely sure. It might reduce cravings. It might help with some of the side effects of quitting that drug. So, for example, we know when people quit smoking, they typically gain weight, and that's one of the problems. One of the reasons why they say they don't want to quit is because they don't want to gain that weight. So if they're taking a GLP-1 agonist, maybe it's helping them to just keep that weight off, which makes them keep quitting for a longer period of time. So there might be something there, but it's early days. So we do see that these drugs are working to help with things like weight loss. They can help with things like cardiovascular function even. They might show some promise with drug addiction. But it does have some problematic side effects. So cure all for everything? Probably not. But really beneficial substance? Probably.